Welcome all of you here this morning. I want to thank Bob Duffy and the Greater Rochester Chamber of Commerce. We are so grateful for their support and belief in this venture. I especially want to thank Shannon Ely, Susan George, and Michelle Hefferon for their time and effort to see this event come to actualization. The Jordan Health Foundation's mission is to help Jordan Health break down the financial barriers to care by seeking support and donations from the community. It became clear to us that to best optimize our mission, we would need to implement strategies that would help the community at large recognize the impact the mystifying nature of healthcare has on all of us. Thus was born the ideal to implement a series of interactive discussions designed to benefit healthcare providers, community-based organizations, and businesses as they confront the challenges of today's dynamic state of healthcare. We also seek to demonstrate the efficacy of federally qualified health centers like Jordan in terms of keeping health costs down and adding to the economic growth of the region. For example, according to Capital Link, a nonprofit organization that works with hundreds of FQHCs to plan for sustainable growth, in 2015 alone, Jordan Health saved the community $38 million annually in health costs. We contributed $63 million in total economic impact, including 505 jobs, both direct and non-direct. And we added $9.2 million in state, local, and federal taxes. Clearly, the ROI of an investment in Jordan Health is a healthy one, very much indeed. I am so pleased now to present this morning's keynote speakers. Lawrence Bowdish is Director, Research and Issue Networks with the U.S. Chamber of Commerce Foundation's Corporate Citizenship Center. Dr. Bowdish started consulting the U.S. Chamber of Commerce Foundation Corporate Citizenship Center on its issue network research in 1913. In addition to conducting and managing all of the research for the center, he also has a sense of humor. He also serves as the issue network lead for food security, where he concentrates on how the private sector contributes to the technology and innovations required to end hunger, improve nutrition, and eliminate food waste. In addition to his work with the foundation, previously he was a professor for the American Military University, teaching courses in U.S. history, women's history, and the history of technology. He also worked as a consultant for county health departments that were instituting public health initiatives for youth and teens in the state of Florida. Sara Zellner is the founder and principal of Lentz Consulting LLC, advising companies and nonprofit organizations in corporate responsibility. Dr. Zellner is currently working with the U.S. Chamber of Commerce Foundation Corporate Citizenship Center to augment their thought leadership through the creation of white papers, research reports, and online tools. Sara brings a unique skill set to her work with a background in management, consulting, public-private partnerships, nonprofits, marketing, and data analysis. I will introduce our panelists after the presentations. In the meantime, our panelists may have a seat. Okay. And we will now listen to our speakers.
Thank you very much. So, good morning, everybody. As Dr. Crawford said, thank you. My name is Lawrence Bowdish. Oh, I can't say in the shot, I guess. Sorry, I'm going to roam in this direction.
You're good right there.
Okay.
Right there.
My name is Lawrence Bowdish. I am an economist and historian. I work for the U.S. Chamber of Commerce Foundation since 2013, not 1913. It's when it started, so I wasn't there day one with like President Wilson or whatever hanging out. So what we're going to talk about today is we're going to talk about how to get, what Sara and I will talk about, is how to get companies and businesses interested and involved in community health initiatives. So there is a whole, this body of evidence that I'm sure most people in the room are aware of about the impact on poor health on communities and businesses, right? And there's all sorts of quantitative numbers from it costs full-time employers $2.75 per employee per hour to insure them. And so the more you can actually reduce that, the better. There are the impacts of presenteeism and absenteeism, so people that come to work because they're sick and they're not as effective or don't come to work at all because they're sick. Those impacts are in the billions for companies. I'm not really interested in talking about that too much today because that's kind of just there. What I do want to talk about instead is helping move away from the transactional nature of talking about how companies and public health officials kind of deal with health needs in communities, and instead develop more, how do we develop partnerships, relationships, and programs that get away from the, I don't want to say carrot and stick approach, because that insinuates but a give and take approach on how companies in the private sector and employers in general deal with the needs of getting involved in the community. So I want to start very quickly with what does health look like here. Now generally when I give these types of presentations, I have to start from like square one, right? This is diabetes and what it does, and this is health and all this. But this audience, I think we're maybe a step or two past that, so I'm not going to dive too deeply into a lot of the real specific data, although we will do some. And then once I'm done, my colleague Sarah will come up and do the hard stuff. I can just read maps. Because I saw a couple days ago Common Ground report come out about a lot of the tying together, a lot of the rationale behind what's behind some of these data points with the actual data, so I'm leaving some of that powder dry. But I do want to start with this. So one of the questions that are asked in health surveys, primarily the BRFSS, is asking someone, how is your health? Right? Getting past the, like, if you're a type 1 diabetic, what's your HbA1c? Have you seen a doctor in the past 12 months? What's your income? What's your BMI? Forget all of that. Just ask someone, how do you feel? Right? So this is Monroe County over the past 3 question cycles from 2013 to 2017, and it's pretty static, right? You see and this is pretty typical for US counties. You've got about 1/6 of the population starting out saying it's excellent, about 15%. But you see a pretty similar trend from 2013 to 2015. And then 2017, we see kind of an uptick and an increase in people who claim that they feel like their health is fair or poor, right? And this is a sort of a general question. How do you feel? 1 to 5, 5 is excellent, 1 is poor. And I want sort of people to keep this in mind because one of the things that you can't really measure when you see the other measures of people's health outcomes and not their wellness outcomes is that it kind of misses the point about what that person needs. And so when you talk to companies about the need to actually do something about health in a place, dealing with healthcare costs is kind of a separate thing. Dealing with how that person is feeling, interacting, and existing in the work setting or in the community is going to come from stuff like this. So I want to show some census maps for Rochester County, or excuse me, Monroe County, Rochester specifically, that talk about some of these other types of questions. So this one is, you had physical health was not good. So there's another set of questions in this study that don't ask you necessarily like, is your health good or is it bad? It's how many days in the past month did your physical health impact your normal daily activities? And this is more than 14. So more than 14 days in the past month, my physical health impacted my daily activities. The darkest areas up here are 22 to 25%. So about 1 out of 5, 1 out of 4 people in the darkest areas, more than half of the time their physical health is impacting their ability to do anything, or is impacting their daily activities. And you see a pretty stark divide. Now, stark divides are not uncommon in a lot of areas, cities, counties, communities in the country. But this is stark in the fact that there is a specific line, which is kind of unusual. This is physical health, this is mental health. It looks very similar. Mental health, same question. How many of the past 30 days has your mental health impacted your ability to do daily activities? Very similar. So we see a pretty distinct need in Rochester for that. And as I was digging through the most recent set of data, I found something that was completely opposite. Right? Now this is really unusual to have, bad health outcomes are pretty static. If you're diabetic, you generally have a high BMI and you're probably taking hypertension medication and all those things kind of happen in the same place, except for this. So there was something where the previously good health areas are quite high and the previously bad health areas are almost don't have that problem at all. Would anyone like to guess what this is? Income? No, this is a health outcome. So it is, but I mean, income would make perfect sense, yes, the higher income is here. This is a health outcome what would be something where this is the one health outcome that's really poor in these areas? Opioid use, that's a great guess, it's not it, but it's close.
Diabetes.
Binge drinking. Love that response. Love that response. So there are definite times, and I don't know, I mean, I'm guessing university is probably around here, and so I just bring this up because there's a lot of ways in which you can hyper-localize ways to impact communities and deal with businesses in those communities. If you're trying to improve food access or healthy food access or access to healthcare, there's definitely ways you can hyper-localize that. But keep in mind, based on the topic you're looking at, it might be harder to do. Maybe you need to, and I need to do a real quick aside here for a second. I'm with the U.S. Chamber of Commerce Foundation. I'm a 501c3. If you have a policy question, I would direct it to any of the gentlemen here from the actual Rochester Chamber. They can deal with that. So anything I say about policy is not a recommendation, just sort of a statement or a point of fact. I'm not making a claim one way or another. I'm not looking to lose my job or change the tax status of my employer. That said, so you can think of things that actually impact one area versus another based on the issue that might be facing. So I looked at the most recent data. So these maps are from the 500 cities from the CDC. The most recent data they have hasn't been mapped yet. And so I mapped a little bit of it, and I'll show that in a second. But I wanted to look at sort of 5 points for the Rochester MSA that really get to the heart of a lot of healthcare costs and impacts for employers. And that is adult smoking, adult diabetes, mental health, so the same questions before, number of days, obesity, and physical health. And as you can see here, the Rochester average, so we get sort of the middle column is kind of the important one. So smoking rates in Rochester are very high, both compared to the state of New York and the country. The rate of adult diabetes is high, but not like barely significantly statistically higher than the US. The same for mental and physical health, and then obesity is pretty significantly higher than the rest of New York State and the country in large. And what I wanted to do is, so I mapped it manually, well, with a program, but I mapped it manually. I had to draw the borders myself. I didn't have a lot of time to sort of put this through our ArcGIS, but for all of those census tracts, the top 10 census tracts for every one of those outcomes is there. So when you look at I'll use the term comorbidity, but I mean it in kind of a positive way. When you look at the comorbidity of these items, they're all happening in the same place, because when you deal with health outcomes, they're very related. If you look at the 10 worst outcome census tracts, they're here. So pretty much in the same group, a couple of holes there. But again, something to think about when you get involved in sort of community health. It's really important for the companies you're dealing with, particularly if you're dealing with small companies, and Sarah will talk a little bit about this in a moment. When you're dealing with smaller companies, it might really be necessary to really focus in on particular areas. And when you can go down to, there are probably 1,200, homes here, and you can really sort of figure out what's going on in these areas. It can be really impactful for a company that might not have a lot of resources to do something significant. And so, one thing I want to talk about is how health organizations and companies work together to make those things better. Sarah will give some details in a second. But I want to sort of caution people that when you look at outcomes for health, and you study the statistics and you gamify and you really work at the statistics and you use that as the reason for why you're doing it, you're going to run into a problem. Because it's like me saying, I'm about to spoil 3 movies, FYI. It's like coming in and saying, hey, okay, in Citizen Kane, Rosebud's the slut. Man, a lot of people here have seen Citizen Kane, okay? I usually name's a lot better than that.
You ruined it.
I ruined it. Rosebud's the slut. And when you see the statistic, it's like hearing that, okay, well, Rosebud's the slut. Okay, well, that doesn't really tell you anything about why he's on his deathbed crying about Rosebud, right? You don't figure that out. It's like saying that Kevin Spacey's Kaiser Sose the entire time, right? You don't, that's important, and that's the end of the story, but you don't really know how it gets there, and you don't figure that out, and Bruce Willis is dead the entire time, right? It's like if you ask someone to summarize these movies, tell me the real important point of these movies, and you've got 6 words to do it, that's it. But that doesn't tell you anything about how that got there, right? If M. Night Shyamalan had come out, if on the Sixth Sense poster was Bruce Willis is dead the entire time, right? It wouldn't do anything. You couldn't get the story, you couldn't do any development, you couldn't figure out what was actually needed. And so, what ends up happening a lot of times, and what I'm about to show is not sort of an example of this, but it shows you really need to have a partnership work together to figure out from start to finish what's getting there, and if you want to pull up on the yoke to fix something, you gotta get there before you're revealing in the last 90 seconds of the movie what the spoiler is. And so I'm going to talk really briefly about CH&A requirements. So community health needs assessment requirements. Nonprofit health providers, to keep their tax status, have to come up with a suite of health issues in their community they want to fix. This is both inside and outside of their actual institutions. So it's not just we're going to treat more people to come in for this. We realize this health issue is a problem in our community and we'll deal with it. And in the first iteration of these CH&A requirements, you saw a lot of health departments and counties working together with their nonprofit orgs, and they were gamifying the stats, right? And I won't say names, but it was in New England. They used their CH&A, and they decided that asthma was the #1 health problem in their community. Seems curious, right? But when you looked at usage rates for the emergency departments, asthma was pretty high. People coming in for asthma treatments. And so there was a university nonprofit hospital that decided, all right, we're going to build an asthma wing. And you've had to do CH&A since the passage of the ACA every 3 years. So this is only like 8, 9 years ago. And a big university hospital said, oh, damn it, we're going to fix it. We're going to build an asthma center and an asthma wing with the university hospital. We're going to fix asthma in this community. And then, sure, so they shunted some people from the ED over to the asthma wing, and they treated people with asthma much more effectively. But it was a 8-figure solution to something that helped address asthma rates. So when the BRFSS data came out the following year, asthma had improved, but they touched maybe 100 people effectively. You know, and they fixed asthma, but that was because they were gamifying stats. Like, what's the one stat we can reach for and fix? And that's not always the way you should, and I'm saying this as someone who's an economist and statistician, so I can say this. That's not always the way you should deal with it. And so here we see what a group of Rochester medical centers, and this is pretty new, have decided to focus on, and you really don't see asthma up here, right? So healthy women, infants, and children is something that's a pretty common CH&A assessment, and you see all of and what they want to do and how they want to do it. Promote well-being and prevent mental and substance abuse disorders. Someone had mentioned opioids in the back. That is a major problem in a lot of places, and figuring out how to deal with it in a way that is extra clinical is pretty difficult. So that's something that a lot of folks are trying to work with. And one thing I've been hearing a lot is this term called deaths by despair. And this is sort of incorporating a newer term that's incorporating opioid, alcoholism, suicides, like everything that we're sort of seeing increase. We're seeing a lot of folks classified under that term. And then they also had other things that didn't really fit into that category. And so healthy eating and food security, tobacco prevention, injuries, violence, and occupational health. And I do want to stop for a second on STIs. I've worked with a fair number of counties and organizations and places where STIs are astronomically high. Like this, it is a major problem. And it's one of the quickest growing poor health outcomes in the country, or STI, or increasing STIs measured by chlamydia infection. But if you are in a group of companies, and I've done this 3 times, and every time I say, okay guys, here's the things that this community needs. It needs better maternal health. Okay, yeah, cool, sounds good. Yeah, kids, mothers, perfect. Yeah, let's figure something out. Food insecurity, nutrition. Oh yeah, people here are really overweight. We need to fix that. And STIs, crickets. So I'm just going to say, I'm going to speak for the businesses in the room for a second. You're not going to get anywhere in dealing with them and trying to fix STI infections. So unfortunately, I think the public sector's on their own on that. And so the next part is that we want to sort of talk about how do community health professionals and county folks get companies to either care or partner effectively. And for that, I'd like to bring up my colleague Sarah, who's going to talk about the report we wrote and more about how to get there.
Great. Thank you all. Thank you, Lawrence, for the introduction. So as Lawrence mentioned, I'm going to talk about the report that we wrote. And this was in partnership with the Action Collaborative on Business Engagement in Building Healthy Communities. So that's a mouthful, but it's part of the National Academy's Roundtable on Population Health. And so basically their purpose is to provide thought leadership, as the National Academies does, around business engagement in healthy communities. And so our report is one of several activities, several publications that they put out. You can find more information about them on their website. But the actual title, and I will give you the exact title of our report, so if you want to look it up, this is it. It's entitled The ROI of Health and Well-Being, Business Investment in Healthier Communities. So the goal of our report was to explore business motivation for investing in community health, the processes involved, and the challenges that stakeholders face when pursuing these initiatives. So for our paper, we interviewed a variety of businesses as well as civic organizations and trade associations. So we didn't interview a whole lot of folks, but we did get a lot of very rich information from them. So we broke it down into larger businesses, and for that we spoke to Amway, which is based in Michigan, Jasper Engines, which is in southern Indiana, For our small and medium-sized businesses, we spoke with Higginbotham, which is an insurance company in Dallas. Vitamix, which you all might be familiar with. They're the blender company. They're based in Cleveland. Ted's Shoes and Sport is a very small mom-and-pop recreation outfitter, and they're based in New Hampshire. So those companies made up our businesses, and then we spoke to the Grocery Manufacturers Association. They're based in DC, and then civic organizations like the Wellness Council of Indiana and the Greater Philadelphia Business Coalition on Health. So those are organizations that have been created to essentially advance community health within those areas. So they are business organizations that facilitate that. So in terms of the features, what you might see in terms of community health programs in businesses, first off, businesses house their community health programs in a variety of different corporate divisions. So sometimes if the companies are larger, they're in a corporate responsibility department. If they don't have a corporate responsibility department, they can be found in HR, they can be found in risk management, they can be found even in marketing and sales. And so sometimes that makes it difficult for external partners who are interested in partnering with businesses to actually pinpoint who they should speak to within the company and who's the principal liaison. But that's just the way it is. So programs typically focus on traditional healthy behaviors or clinical health, which you might expect. So your fun runs, your health fairs, building playgrounds, that type of thing. Excuse me. So there are other aspects of health that businesses don't necessarily focus on necessarily, and those are more of the environmental factors. So things like air quality, water quality, which can be improved, even housing. So community health programs can dabble in that, but oftentimes you'll see that businesses focus in very traditional ways in community health. And then finally, we found that there are budget line items. So for those companies for whom community health is very important, they'll have budget line items that are dedicated to advancing those programs. So there are several reasons that businesses get involved in community health, and these are actually taken from previous research. So oftentimes you'll find that businesses get involved, and you might be familiar with this, to reduce healthcare costs, to enhance organizational reputation, to stimulate new business opportunities, to draw in, attract and retain your talent, and then to influence other drivers beyond healthcare costs like healthcare quality that can be improved not only in your employees but your customers and the community at large. So those are things we had found from previous research. So the types of programs that businesses engage in, and it varies. Oftentimes we find that partnership is critical for all businesses that get involved in community health, as you might imagine. So these businesses are not experts in the field, so they partner with their local government entities, their health departments, or with local nonprofits who really have boots on the ground and are very knowledgeable in what they do and what's important to the community, and thus those partnerships are created. Health advocacy is also known to take place, so certainly lobbying for important community regulations that are important to community health. That we've seen businesses do that, they talked about it. Innovative products and services, so that's also, I think, easier for businesses that are involved in the healthcare industry or other industries related to health like food and beverage or sports and recreation. It's easier to make that jump. But we also saw that businesses that aren't in those industries can get involved. So for example, I mentioned Jasper Engines in Indiana. So they have, I think, roughly 5,000 employees, and they're in a relatively rural area in southern Indiana. And so their employees, they found, were having to travel quite a distance for healthcare, to go to their doctor, their dentist, what have you. And so Jasper Engines, being a relatively large company, they decided that they were going to establish an on-site healthcare clinic, so that way their employees didn't have to travel. They and they were healthier as a result. You know, they weren't stressed out having to go 45 minutes one way just to go see their doctor and then go pick up their kids afterwards for another hour. So so that's an example then of a non, I guess, healthcare industry company getting involved in community Employee volunteering, some of you might also be familiar with that, might also be involved in it. So certainly having your employees participate in fun runs, in health fairs, in building playgrounds. We definitely see quite a bit of that. And then finally, philanthropy. So that can certainly take place through sponsorships of again, the fun runs, the health fairs, or for larger organizations, it might take the form of grant making and providing those funds to support local nonprofits in their endeavors. So as you might expect nowadays, so program measurement and evaluation data is very, very important in measuring the outcomes and the progress of community health programs for businesses. So businesses want to make certain that they're investing in something that's working, and so measurement is obviously part of that. The measurement oftentimes is not very advanced, it's not very complex, it's typically very narrative, metrics of participation, the number of units donated, but it's still something that, that in terms of data uses, that businesses can take back over one and certainly assess to consider the success of the program, assess their partners based on it. They can use it for their marketing purposes, corporate responsibility reports, if they put those out, and then they share it with their senior management and their boards to justify the existence of programs and to think about how they might determine the direction of future programming. So keys to success. So these we would probably say are the main two keys that we heard from in terms of what businesses told us. So I touched on partnership already. As mentioned, it's businesses told us that just having somebody who knows the community, obviously much better, knows the community health experiences, just the environment much better than they do, is essential to true success. So, and that can be not only a nonprofit partner, but also, as mentioned previously, the trade associations, the civic organizations that might be in your community to help facilitate those types of programs. And champions. And I just have to give a quick shout out to our Washington Nationals here that just won the World Series. So they're just up there. But I'm talking about champions within your businesses. So basically, someone who's going to be an advocate to have a community health program, to establish that community health program, for whom it's very important. Sometimes it's personally important. Sometimes it reflects your business model. So that can be your CEO, that can be senior management, it can be members of your board, it can even be your employees, so who have been affected personally within their communities and feel that's important and bring that to senior management. Champions can come from the outside too, but oftentimes we see businesses are motivated more by internal champions. And then other keys to success, and these are probably related to the partnership and the champions, are alignment of goals. So certainly when you partner, seeing eye to eye certainly makes a difference. I'm sure you see that in your day-to-day business activities. But if you understand each other, understand each other's goals, how the processes are going to work, you're going to get along much better, your programs are going to go much better. Community readiness is also very important. So some communities aren't ready for you to, say, start an obesity program or what have you. So an example of this is the Wellness Council in Indiana. So they had a program that they wanted to expand to another city. And so they found that, communities are different, like even neighborhoods are different, as we saw Lawrence present, and there's no one-size-fits-all solution sometimes. And so basically they had been advancing pretty quickly to get this program off the ground in this new city, and realized they needed to pull back, they needed to do more research, more partnership building to actually make the program a success. And so that is also quite essential. And then finally, stakeholder support. So certainly getting all your stakeholders on board to support your community health programs, super important. Your boards, they're probably extremely important just to get buy-in from, and then your employees and your customers. So oftentimes, if you want their participation, you'll need their support, and getting that is certainly another key to a successful program in community health. And there are certainly challenges that exist. So Again, you'll find this in your daily work life, so differences in work style, perhaps between the private sector and the nonprofit and public sectors, it just varies. So as you might expect, the private sector is very nimble and can move quickly on things, whereas the nonprofit sector, some nonprofits don't have a lot of staff, they don't have a lot of resources, so they may not be able to move as quickly. And then with the public sector, there's a bit of bureaucracy there, and so that needs to be navigated, and so that can be a challenge. And so again, businesses need to find that compromise between wanting to be involved and wanting to participate, and then setting expectations and goals. Alignment of priorities internally or externally also can be a challenge. So certainly, if you're not on the same page, you're just not going to be as successful. Adapting to regulations. So we heard from businesses, this didn't, at least within our businesses, this wasn't a very frequently cited challenge, but it can be a challenge. So, case in point, Vitamix had a program in Cleveland where they were providing their blenders to local schools, and those local schools were using the blenders to create smoothies for disadvantaged kids at a reduced rate. And basically what had happened is some regulation changed, either locally or statewide, that no longer allowed those smoothies to be subsidized. So the schools no longer use the blenders. They no longer made smoothies. So that was the end of Vitamix's program. And that's just one example of how regulations can become a challenge in your community health program, albeit maybe a rare one, but still it can be a challenge. And then finally, long-term sustainable funding. So this can be a challenge for any size business, but particularly for smaller businesses that obviously might have fewer funds to dedicate to their community health programs, but it can be a challenge. So then finally, so the key takeaway is where there's a will, there's a way. So basically, if you have passion, if you're willing to go out and find partners, or partners are willing to find you, really excited to work with you as a business, and you're equally passionate, you've got a champion or champions who are willing to go forward with a community health program, it can happen. It can happen. So. The biggest difference we found between our large-sized businesses and our smaller businesses was around staffing and funding. And then finally, for our local civic organizations and our trade associations, they play key roles. They aren't essential, so if they aren't in your communities, it's not make or break to have a successful community health program. But they can certainly facilitate that relationship with your communities and advancing your community health agendas by being intermediaries within the communities to improve community health. So with that, thank you so much.
Thank you. It now gives me pleasure to introduce our panelists. From left to right, Wade Norwood, who is the president and CEO of Common Ground Health. Jake Flights, director of benefits at Paycheck. Bessie Storm, president of wellness programs with Value, WPV. And finally, Eric B. Bond, who is the president of Barn Benefits Consultant, and Dr. Bowdish and Dr. Zellner will facilitate the discussion and be responsible for getting us out on time.
Thank you, Dr. Croft.
Thank you. So I can't see most of the audience in the corner, so I'm going to just move over here so I can see everyone. So what we'd like to start with, obviously, for the panel, if I can ask really quickly, just to take the pulse of the room for a second, can you raise your hand if you're with the private sector, with company or like that? Okay, maybe a quarter-ish. If you're with a nonprofit, maybe third to half, and then public sector? If you didn't raise your hand for anything else? Okay, so just keep that in mind, because what I like to do is, as you introduce yourselves, those sectors may know who you are, who you aren't. So keep that in mind. What I'd like to do is spend a couple of minutes for each of you just intros who you are, what your organization does, and then how that plays a role in addressing health issues for companies or the community at large. So I think we have 2 mics, but Wade, I'll hand you mine.
Thank you very much. Good morning, all. My name is Wade Norwood, and I am the CEO at Common Ground Health, which is the health planning entity for the 9-county Finger Lakes region. We see our mission as bringing focus to regional health issues through our research data analytic, through our community engagement, and through leading collaborative efforts to develop solutions design for those regional health issues. I would say, in terms of framing, and then I'll pass the mic away, that I think that it is incredibly important for those of us who live in the Finger Lakes region to understand how unique we are in the nation, in that our business community, our private sector and entrepreneurial history has always been characterized by business leading community improvement and by business understanding the incredible importance of the health of the community. Our roots are in Colonel Rochester and Austin Stewart and Hiram Sibley, the names of those giants of the 17th and 18th century and 19th century as well, who really led the development of this community. But most importantly, we really need to understand the legacy of Eastman. And the legacy of Eastman was that this community could be built if we promoted the public health by understanding that the investment is not just in the clinical system, but in the non-clinical. And the tradition of Eastman, not only in the dental dispensary, but in the Eastman Theater, and understand the University of Understanding Arts and Education are the important pathways by which community is improved. Our opportunity, I think, today is to recognize that addressing these data points that we saw and the data points that we released in our recent report, Overloaded, the best pathway, the most efficient pathway, is not to just think about medicine, but to think about people's lives. And that's why I am delighted that the Jordan Health Foundation invited us here today, because Jordan truly represents the model of understanding that we get health improvement by understanding how to address the non-medical things that are present in people's lives.
Hi, I'm Jake Leitz. I'm the Director of Benefits at Paychex. I've been at Paychex for 14 years now, and I've got the things you would normally think about with benefits. Retirement, medical, prescription drug, dental, our wellness, well-being programs. At Paychex, we spend a lot of time talking about well-being. We define it kind of very similar to what Tom Rath, if you're familiar with his work, so we borrowed liberally. Nice way of saying stole. We just sort of reframed it a little bit. We focus on physical well-being, emotional well-being, financial well-being, career well-being, and community well-being. And we define community at Paychex as both their work environment as well as what we're doing as an organization and what our employees are doing outside of our walls. I would say the one thing, I would agree with Wade, that makes us unique. I've been the good fortune of doing a lot of things nationally with Paychex, and when I talk with other employers and other communities, and I describe what we've done in Rochester, all the way back from Marion Folsom, I'll come back to the 60s, all the way back into the 1800s and before, is that businesses have always been involved. And I'll have employers ask me, like, how do you guys do that? How does that happen? Because we would love to do that. The other thing of note, and then I'll pass the mic on to Betsy, is when I interviewed at Paychex 14 or so years ago, I had to speak at the time with Marty Musi. And Marty's our CEO now. At the time, he was our COO. And we spent probably 2/3 of the meeting talking about my experience and what I would do at Paychex. Of course, me asking him questions. And the other third was about this new group of, this new effort when a group of employers had come together to approach community health in Rochester. Its latest incantation, because there have been many, which I think is just really indicative of where Marty's head was at the time, and where it continues to be, and not only Marty's, but other leaders in the business community.
Hi, I'm Betsy Strom, and I am the president of an organization called WPV. And what we do is we work with different organizations to develop and refine their wellness programs within their organizations. And we also help them to focus on all of the things that Jake talked about in terms of what defines wellness and how do you help your employees to define that for themselves, because at the end of the day, a community is really a bunch of individuals who come together, and a work organization develops that community. And so I am actually a nurse by trade, and prior to being in wellness, I did community health. So I was a community health nurse. So this works really well for me to be here and see how what I used to do helps what I do today. So what we do is really on the ground floor, grassroots, help organizations to develop what their community health is going to look like.
Good morning, I'm Eric Bond with Bond Benefits Consulting. We're a benefits broker and consultant, so we help small businesses, large businesses, private municipalities, and nonprofits to get set up with the health insurance and other benefits that they offer to their employees. Our goal really is to help make sure that they are able to maximize the value of the dollars that they spend on those benefits. At the organizational level, that can be by making sure that the benefits they offer advance their strategic initiatives and help to move their business forward, whether that is through profit-driven or community-based motivations. At the individual level, we want to make sure that we focus on ensuring that individuals are educated about how their benefits actually work, how their benefits can work, and making sure that they maximize those. And anytime that they don't work, making sure that we step in and fix any issues that come up.
Nope, I got it. I am the oldest millennial, so I can fix microphones. and I take notes on phones, taking notes. I'm not tweeting or Instagramming, but taking notes. So I'm going to play devil's advocate for a second for the first set of questions. So particularly Wade and Jake, and I think I'm going to vote for Betsy and Eric's points about how the Rochester business community has been involved, long historical evidence for being involved. So I'm going to play devil's advocate for a second. So chamber people, cover your ears for a second. Then why are the health outcomes in Monroe County so bad? Is it? I mean, if I were looking at it sort of, I mean, if I were looking at it just with those two data points, I think, well, maybe businesses shouldn't be involved. Like if that's something else. So I'm curious if they should be. That's no. So I'm asking, is there something about Rochester, something about how the engagement hasn't had enough traction? Like if you could say something about sort of answering to that sort of devil's advocate question, why that's been the case. So for all of you, but I think you came up most with your presentations.
Whichever. I would say that two things that our data suggests that we really need to pay attention to. The first is that since 1970, the impact of white flight, bright flight, and then green flight have done much to hyper-segregate this community, to really create environmental conditions that are so dissimilar between urban, rural, and suburban that we have yet to really embrace the understanding of the social determinants of how environment and socioeconomic circumstance really drives health outcomes. And so we are engaged right now in this great conversation of understanding health equity is not going to be achieved through the health system alone, but it's going to require addressing living conditions and social and structural and economic inequity. And then secondly, I would say, which is why Jake is such an important partner for me, is that we need to understand that also over the course of the last 40 years, the employer of the very poor, those who live in households that earn less than $25,000 a year, the employer has changed dramatically. It is no longer a regional employer with decision rights to really address what's going on in the lives of the employee. That employer of the very poor now is generally a national or international chain, driven very much by the quarterly stockholder imperative. And really it requires a different conversation to get that employer, and I could name any of the retailers, and many of them I hope you are thinking of, the employer of that person at the cashier register who's an hourly employee, who taking the time off to get their child to that adolescent appointment will cost them anywhere between 5 to 20% of their weekly income. They're not going to do it. And that requires a different conversation with our business community, because we need to understand our business leadership has changed dramatically, and that's why the chamber is an important asset for us. Because the conversation employer to employer, local to non-local, really needs to take place in the lingua franca of the business community, not in the lingua franca of those of us who are soft-hearted, soft-headed, progressives, just trying to make community life better.
Thanks, Wade. Yeah, I would definitely concur with what Wade said. I think it's not only a good question, but it's a really important question, right? And let me kind of talk a little bit about the high blood pressure collaborative and the work we did and some data points, because I think it's really telling. In one anecdotal story that we heard that just resonated with a lot of us, especially the employer rep. So the data, over a 10-year period, we improved blood pressure control in Rochester by about 8 data points, up into the high 70s. Our goal was at that, when we started, was to try to get to about 85.
We broke an 80.
Okay, so we broke an 80 now, which Kaiser has, which is, those folks in healthcare know, is a closed model, and we're dealing with not an open model, the entire community. And so that was really interesting to see that steady growth over time, and there were a lot of good reasons behind it and a lot of folks involved in that. But the one thing that we didn't do, that we also wanted to do, was to reduce disparities. So what we saw is this kind of rising tide lifting all boats, but not equally. So we still have disparities. So we looked at, well, why is that? And I think it takes us back to, there's only so much you can do when you're using the medical system to intervene in health conditions. And I think we saw what we could do. But then you've got to look at other factors. You've got to look at poverty, at income. You've got to look at education. You've got to look at transportation. All these things are tied together, and it just reminds me of what we're trying to do at Paychecks, which is to take a holistic view of our employees. It's not one thing, it's 5 dimensions. And we know if we're low at Paychecks, if one of our employees is low in any one of those dimensions, their overall well-being is low. Not only that, it's more insidious, right? Because if I'm low in one dimension, that can create further impact on another dimension, right? If I'm low, if I have financial issues, I'm over my head with debt issues or credit or whatever, that can impact my emotional well-being, my physical well-being. These things are all tied together. And then lastly, the thing that really struck me, and I know Wade will remember this, is when we were talking initially about high blood pressure, we heard from a community resident who said, listen, I know I have high blood pressure, but I have rats in my basement. And those rats are more of a primary concern for me and my family than my high blood pressure.
So that's, I mean, it's interesting to hear that. One of the things that I was getting out of the presentation, I think something that the second half table can speak on, is, Wade, I was looking at the report you guys put out a couple days ago, and my hypothesis when I came here was that Monroe County would have a particularly low primary care availability. And when I saw that you had a chart that's do you have a primary care doctor you go to? and it was 86%. The national average is 87, right? So it's not a care availability question, right? It's not, these people have doctors here at any same rate everywhere else in the country, across income levels, which I think was the important part of your finding. And so I'm curious, particularly for the folks that are dealing with what community health looks like. I mean, maybe for those in the room that might not have a good sort of not silo, but think like, well, treatment for the individual and the healthcare setting versus the other part of that the entire part of that person's life living in particular places and food deserts, all that sort of thing. So I'm curious if you wouldn't mind, Betsy, I think, and you mentioned it for if Betsy, if you wouldn't mind talking about that generally, and then Eric, you use the word I hear people in your market use is benefit spend, right? So not just insurance or whatever, thinking about how that holistically looks and how some of those things could impact things sort of beyond like clinical care. So sort of talking about how we get beyond it as a conversation.
So how we get beyond clinical care in terms of
what it looks like.
Yeah, and what it looks like. I think Jake really said it very well, that it's not just about my blood pressure. And I have a team of nurses that go in and meet, do nurse wellness coaching in organizations, within organizations, and that's exactly what they hear is, I have rats in the basement, or my kid is addicted to opioids, or I can't afford to pay my car payment, or they're doing cutbacks, and so I may lose my job. So many things impact people's physical health that you can't really silo it. Everything really is affected. And so you have to take care of that whole person, and unfortunately, for business owners and business runners, it's a different world than when you're a large organization that is a national organization, and you have hundreds of thousands of people working for you. I think it becomes difficult for them to recognize that those people are people and they are individuals, and the things that impact them coming to work and working for you well every day, you have to invest in. You can't just say, all right, here's your job, here's what you're going to get paid, and we'll give you benefits, etc. And I think that's difficult also for the business owner as well as the individual. So I can see both sides of the coin, where it's difficult to run a business and have to think about all that, but at the end of the day, you have to. Because there's no way to get those people to be people. And in order for them to access health care, they have to be complete. And the world has changed, and as business owners, we have to take care of our people.
Yeah, and Eric, I think before you take that, I'd like to sort of add something to it, because Wade, you're talking about the difference between large multinationals, local companies, and their feelings on the ground, and Jake, you're talking about Jake and Betsy, you're talking about the families that have other priorities they need to talk about. Well, small businesses have the same issue, right? When I talk to small businesses about this issue and environmental issues and D&I and things like that, they'll say to me like, Lawrence, I'm a 10-person company. If I don't finish this contract this week, I have to fire everybody, right? So I think Eric, if you would start thinking about how do you get sort of companies to get beyond like the fire that's happening right now to like the fire that's going to happen in 1, 2, 3 months or next year, like have companies think about it and using sort of the benefit study for that.
Yeah, absolutely. And I think taking that holistic view is absolutely, it's a perfect analogy from the individual to the organizational level. Even when you step away from the business that is, needs to finish that contract, or they're going to have to fire everybody. If we look at the organization where their benefit spend is starting to get out of control, and they look at what are we spending on health insurance for our employees. If someone comes to me and says, I need to save money on my health insurance right now, well, that's easy. We reduce what you pay towards your employees' health insurance, and they're going to pay more. But that's not going to be a long-term fix. If you really want to reduce what you're spending on health insurance, you probably need to invest. You need to invest in your employees' health. You need to invest in their education. you need to invest in not just their health insurance and not just spending more on their health insurance or giving them better health insurance, but investing in their health, investing in their mental well-being, focusing on the absenteeism and presenteeism, as you talked about a little bit before. I think one of the things that we've seen a growth in over the last number of years is moving away from just what is the spend on health insurance towards what is the value of the overall benefit spend. How does the health insurance work with other insurances? How does it work with mental health? How does it work with work-life balance, financial education, financial wellness education? And recently we've seen a lot of inclusion of kind of community-based initiatives into that overall benefits package. Do we have a community volunteerism team? Do we have opportunities for giving back to the community? And I think that is a tremendous improvement. I think the challenge is when you spoke about the example of George Eastman. And the problem that we face in this community is over the last 20 or 30 years, as Eastman Kodak has really fallen off the radar, we really are a small business driven community. And small businesses, I think, have really stepped up in terms of what they want to give back. But the overall focus in terms of that give back seems to have been either the team building and the volunteerism or the reputational. And there's been a lack of community-based strategy. And a lot of individual players without a cohesive strategy have had a hard time kind of moving the needle in terms of the overall community results. And having a coordinated strategy is a way to really help that. And without one major business that is the anchor of the community driving that, you need to find a way to bring together these smaller cells.
Well, yeah,
And to Eric touched on this, and you did, Lawrence, too, right, from a small business perspective, right? So many of the folks know in the room, our market are small to mid-sized businesses. So we know they work with over 700,000 employers in the United States. So I think the key is from a small business perspective, is the impact of health on productivity. And whether it's disability claims and probably more importantly, absences. And not just block absences, but intermittent absences, right? And here's where I see it. We've got over 15,000 employees now in the US, 4,500 in Rochester, right? So if my group is about 22, 23 people, and if somebody's not in today, it's gonna be okay. We don't have to call anybody else in. We're gonna kind of go right ahead. And if they're not in tomorrow, we'll get through that too. But at one point in time, kind of irony, I think, I have leave as a responsibility, absences, disability, LTD, all that good stuff. And it's about a 7-person team, and I was down 4 people for an extended period of time. And so because I'll hear from departments like, we have got to do something about this. What are you guys doing? What are you doing? Like in leave, why can't you get these people back? Why can't you, keep them from going out? And I'm going, I get it. We're down too. But I think that's the key. So because I think your question in part was like, why and how can I do it? And I'm strapped for resources. But I know when we had 50% of our capacity was gone, it was brutal on the folks that were working. And my biggest fear was I going to come in tomorrow and the next person was going to be out. And they were going to be out because of stress.
So to build on that just a little bit, Sarah mentioned Jasper Engines, and one of the things that was really interesting about them in Southern Indiana was that, if you have a doctor's appointment, you're out half the day. Doesn't matter, right? And they had a couple thousand people, but they're heavy manufacturing. There's probably a Jasper place in here in Rochester. So what they do is they rebuild transmissions primarily, but they don't do them in the shop down the street. They send them to Indiana, right? And so if that rebuilt transmission just sits on the table, it sits on the table, right? It's not one of those things where other people can correct it. And so when they built the clinic, that helped. But then they realized, well, they got to go for their kids' appointments now, and so the clinic started taking the kids, right? And at that point, once that clinic started seeing Jasper employees, their spouses, their kids, they're seeing 2/3 of the community anyway. Saying, "Oh, screw it, open everybody." At this point, I mean, they're seeing everyone anyway. Now that's a little, I think beyond the pale for some of the companies in the room, but I'm curious, since we're focused a little bit on the small company, what are some of the ways that they can, like some of the mechanics by which they can, you know, get to, all right, my employees are doing okay, you know, I've gotten to the point where it's not, you know, I'm not gonna shut the doors and have my team doesn't show up or whatever. How can they make the transition from going to the internal to start thinking about external communities? You know, like how, like what is it that can help them sort of take that step?
Well, I think from my perspective, there are two really interesting things happening, right? If we think about, and as a father of two millennials, it's always good to blame them for a lot of things. Just as my dad did to me growing up. And when you guys take over, I hope I'm not around because it's not going to be good, right? So I do the same to my sons because it turned around, you know, fair play. But I think, and I'm always careful about kind of labeling generational things because the generalities and stuff. But I think, at least we see it in our organization, there's an expectation among our younger employees, millennials, Gen Z now, that not only is the company going to be involved in the community, but they're going to be able to be involved too. They want to be proud of where they work, right? More than just what they do in their job. So we have that pressure, that internal pressure and that recruiting pressure to do that. And the other thing from a business reason is, the reality is that's our pool of labor. That's where it's going to come from, right? And we don't know, you know, today somebody, you know, could be working at another company that Paychex tomorrow, or Paychex employee could be going someplace else tomorrow, right? Or there's somebody out there that's not working, that's just entering the workforce, or took a break from working for a while. And then the last thing I would say as it relates to Rochester is, you know, we need a vibrant community, multidimensionally, to attract and retain people. And I know this, we've got to do some things to get growing again. Growth is good. If I've learned one thing in my life, it's better to grow than to stay stagnant.
Amen.
Stagnation is falling behind, and that is a losing battle. And I think there's certainly the brain power in this community. I'd like to think that there's a will to make it happen, because that's the only thing that I think will prevent us from doing it.
If I may, I'd just like to piggyback off of that, responding to your question with one of Sarah's slides, where she talked about, first of all, the importance of alignment of goals. And I would say that we have been incredibly blessed in this region over the course of the last decade by the powerful role that the Chamber of Commerce has played in terms of helping business people who are at that point of saying we want to think beyond our own workforce to the community, or more importantly, as Jake said to me when I first met him, we want to think about our own workforce but recognize we only have them for 40 hours of the week. That the rest of their life is in the community, so we need to connect with the community. I would urge anybody who is thinking in this space, with the Jordan Foundation, Ellen is here, the Chamber, Dan Smith is here, and Jake himself, if you're at that space of saying, what can I do to be connected with folks that you can share your goals and find alignment, is the critical first step, because there's strength in numbers. The second point that Sarah's slide made was community readiness. And I think it is incredibly important for employers and entrepreneurs to understand that the grassroots community, the voluntary sector, and the public sector are really ready for partnership and really ready to understand how it is that we can make partnership to really address multi-solving opportunities, where if we do something, we're changing an education needle, a social needle, and a health needle all at the same time. And then the last thing that Sarah said in her slide was a stakeholder support. And going back to Jake's anecdote, I am incredibly possessed of the moment when Jake and other business leaders came and sat with our African American Health Coalition and our Latino Health Coalition and really had a conversation about why it is, when we have such great systemic measures we're getting shitty outcomes. And it wound up being a moment after about a half hour, 45 minutes of conversation, race and ethnicity disappeared. The class and power differentials disappeared. And it became a conversation that, you know what, we're all human beings who simply care about and love the people we care about and love, and we all need help to figure out how to do this thing called life. And that powerful moment created a bond between, I know, the grassroots in this town, the barbers, the beauticians, the church lay health ministers, and high power, highfalutin HR business folks like Jay that have persisted to this day simply because of the fact of building connectedness at the human level. And that's what I really think this conversation's about. The best workplace is a workplace where the employees really do believe they're seen as human beings and cared about as part of an organizational family. The best neighborhoods have the same damn characteristics, and the best communities are the same. This is really what Robert Fulghum said, everything I needed to learn, I learned in kindergarten. This is about how do we hold hands and cross the street together.
So I'd love to build on that and have maybe everyone chime in. So Jake, you said you've been with Paychex 14 years?
Yeah.
Wade, how long have you been with Common Ground?
Since January of '06.
Okay, perfect. The two of you look too young for this question, but have you been? How long have you been in Rochester?
My entire life.
Okay.
42 years.
Eric, I don't believe that for a second.
I grew up and left for about 7 years and then came back about 7 years ago.
Okay. So one of the things so Wade, you queued me up perfectly without realizing it. One of the things that, being from the Chamber Foundation, this is not a U.S. Chamber of Commerce 501c6 point. I want to think about 2008 for a second, right? The Chamber of Commerce official line is that fears of a recession are overblown. That's their official line. So what is going? I hope I'll still be employed. So I want to think about what Rochester was like a decade ago, right? And think about sort of what happened in that recession, which was primarily focused on housing and credit. So maybe a different impact than what the next one will do whenever that hits. A different impact than what the next one might hit. And curious about how do we build these personal relationships, things that go beyond the economic rationale, to make Rochester more resilient, to get through it both for the employment community, for the health, because there's a lot of areas in health that Rochester and many places in the country, they won't survive in a recession, right? Some of these things are on the precipice, and a recession could really sort of push them over. And I'm curious, what are ways that we can build sort of resiliency in some of these programs that either make them more sustainable or bring in multiple sectors? Just curious about thoughts about that. Thinking, because I was not in Rochester 10 years ago, thinking about what happened then and lessons we can learn moving forward.
So I was boots on the street, literally. I was in community health, in people's homes, taking care of them at that time. And I think one of the things that I saw, just anecdotally, because I was not in leadership at that time, was a lot of communities started to gather together. Community centers started to be more prevalent, and the ones that were there became more attended. And so people started to take care of each other during that time. And because there weren't finances to do it, it was necessary to survive. And so a lot of the attendance in community centers and food pantries and things like that really started to increase. And people were, I just love the whole connectivity conversation. People were, even though, financially stressed, looking for connectivity, and you lift each other up as a group, and that's what I saw happen at that time.
Do you a quick addition to that? Do you think the community centers now, and I'm including the most broad term of that, so community centers, FQHCs, et cetera, do you think they are ready to have wellness conversations?
I wish they were, but I'm gonna say no. I don't. I think it's still reactive at this particular point in time, and I think that probably is a big piece of our problem, is that we're very reactive. And I want to revert just for 1 second, because it was such a good point about connecting. And I think as time goes on and we become less connected to one another and more connected to our devices, I think where we work becomes an even more important part of our community, because for some people that is their only community and their only opportunity to connect with other human beings.
Just real quickly, by comparison to what Betsy was talking about with the community engagement and people coming together in Rochester in 2008. I actually wasn't in Rochester in 2008. I was in New York City at the time. But I was, had family here, so I was coming back and got an opportunity to anecdotally kind of compare the two. And it was a very different feel. New York City in 2008 was in many ways the epicenter of that financial crisis, and there wasn't as much community involvement, community engagement. There was a lot of people kind of turning inward. A lot of the community services that had relied on corporate support, that corporate support dried up, and they found themselves coming up short. And it was really interesting by comparison to see how the grassroots support here in Rochester really led to a much stronger groundswell of support.
So I would maybe just add, 2008 seems so long ago. Although the time's gone fast, how did those two things exist at one time? So it was in it because in 2008 is when we started the work on the High Blood Pressure Collaborative, and it was myself representing Paychecks, Becky Lyons at Wegmans. Larry Becker was key to running around the community with me around high blood pressure. He was at Xerox at the time, Renee Brownstein at RIT and George Descoulias and some of the characters have changed over the year at Kodak. But so while we were going through this awful thing nationally and locally, we were looking at doing something within the community, and I know none of us took a step back. We just kind of went through that. So the other thing I would say is that Paychecks, maybe this gets to resiliency, your question. So at Paychecks at the time, we didn't have a layoff as a result of the economic, the significant recession that we were going through. We did suspend merits for a year, and we suspended match on our 401k. But everybody knew that they would have a job. And I think resiliency, for us to be resilient, we've got to always have a sense of hope and some level of optimism. And I can tell you at Paychecks we had that. We had no doubt we were going to weather this and come out and be okay, and that people would be okay in the meantime. And I think that's what, when we look at the numbers that you showed, my fear is when people lose that sense of hope, then you do get ultimately death by despair, right?
I'll just chime in to reflect back to the Great Recession, which we really should be calling the Minor Depression, because that's what it was. The false narrative of our history is that the crisis was created by inappropriate lending for housing for those who are lower or moderate income, and that is bullshit. It was really about the hedge fund and the high-end stuff that was irresponsible and illegal. But the reaction has been the contraction of progressive lending to help promote home ownership and wealth building that we really saw during the 90s. We were actually closing the racial and ethnic gap in wealth. It has gone back to widening. And the key challenge, I believe, to this regional economy is the housing overburden. That we have, my neighbors 2 minutes away from here are paying 2-3 times as much in monthly rent as I pay for my monthly mortgage. And it's only because of the fact that they can't get access to the credit that will support a mortgage. And I cry bullshit when I see that. I mean, we should be directly changing that. And addressing poverty is not just about giving people more income, it's also about reducing the expense. And this would be an incredible way in which we could change lives if we could convert folks in the region who are paying outrageous overburden on rent into paying a reasonable amount towards home ownership. And our data, please go to commongroundhealth.org. I'm plugging my own self. The data is very clear. If you look at health outcomes by occupancy, those folks who own their own home, irrespective of income, have far better outcomes in terms of health than their counterparts. And the same is, I just saw a set of data. I keep saying to folks, I've only seen 20% of the data, the tip of the iceberg, and every day they give me a new joy at work. I just saw a set of data on elders, folks 64 or older, health outcomes. If those folks own their own home, they are incredibly better well off. And surprisingly to me, if they have a job. And I think that has a lot to do with social isolation. If they're working, they have far better outcomes. So what I would say is, looking back at 08, I think we forget how huge a crisis the nation was in. And there were radical steps taken just to preserve and protect jobs that in hindsight we've forgotten about. One of those actions was the race to the top, to plug the gap to keep school districts from laying off thousands of teachers in communities. But the consequence of race to the top was we wedded ourselves to test scores with regard to education. This is the window. The next 2 years, we must undo that. The Board of Regents are going to redefine high school diploma requirements by the end of 2021. And I pray, God, that across New York State, we will be far more focused on problem-solving skills, teamwork skills, resiliency, than test scores. Because those are the skill sets that college admissions officers, that employers and neighbors tell us are essential for the future. Nobody's really impressed that I got a 98 on the Regents chemistry exam in 1980. I am, but I really know nobody else is. Thank you very much. Thank you. I think what's far more important is the fact that I have the ability to communicate, to receive and understand the communications of each other, of others, to separate fact from opinion, and to understand how to disagree, but still be part of a team that's building a future. I think those are skill sets that we absolutely need the business community. I pray to God, if the business community and the Chamber of Commerce still thinks this is about a single score that is a commodity, we're in frickin' trouble. And we need your voices to be heard. And the last thing I'll say, because I think I just want to amplify a point that Betsy made, I don't think it's a matter of the fact that the FQHCs are unready to do this work because their capacity or will is misplaced. I think it is they're not ready to do the work because the funding isn't there that allows them to be collective. And I think that's the other thing that we need to do as a community, is really make the argument that my nana was right. We would be far better off to buy ounces of prevention than to continue to spend all of our money buying pounds of cure.
Thank you. I do want to ask one more question based on some things that have come up in the past a little bit, and then we'll go to the audience, so think of your own. And so we'll try to do this one relatively quickly. We've got about 8 or so minutes before we go to the audience. One of the things, Betsy, you talked about was sort of bringing together the social associations. So I know both my colleagues Sarah and Dr. Crawford are sociologists, so I won't pound Robert Putnam over the head with the declining communities. But I was asked about a year ago to do a report on the connection between health and wealth. And of course, when you sort of plot counties' health scores with their income, it's a pretty highly correlated. Whenever it's 0.7 R squared, their health levels tell you a lot about their income. What I did is I took there were 27 counties that were more than a standard deviation above where you'd expect them to be in income. So they had relatively bad health for relatively high incomes, to figure out what is it about those counties where they have the resources to fix things and they aren't. And what I found is that those 27 counties shared one poor health outcome, or one poor health characteristic: bad social associations. That was the one thing they all shared. It wasn't diabetes rates, that was high. It wasn't diabetes rates, it wasn't obesity, it wasn't my mental health's poor. It was all of them had very low social associations. And you had mentioned, I think, and Jake, you had talked about the workplace is kind of now where you see other people, right? I can't speak much for Rochester, but nationally, it's not like, the Kiwanis clubs and the Shriners and the women's auxiliaries and the bowling leagues, for the Robert Putnam example. There's fewer and fewer and fewer of them. And so, curious for those of you, Eric and Jake, working for the employers, or, Betsy and Wade working with the communities, what role can the employer play just to be building the social associations amongst their employees? Someone where, and the definition of that is you need to call someone at night to go to the hospital, you can call someone to take you to the hospital. Right, and so curious if you develop that a little bit and talk about how to keep that as a preventative to there being other issues.
Can we go first? So, and I think this is, at least from our perspective at Paychecks too, and it's more than semantics, right, too, because we'll talk a lot about work-life balance, which I think is foolish, right? I think we need to be talking about work-life integration. If we start from work-life integration, then we start to understand the importance of fluidity, right? In community at work and community outside of work. And we do things, we know it's in our best interest that most of our folks today work in teams or not working independently. So anything that we can do, Wade touched on this, to improve team readiness and skills to work within a team. And what that means to address is just a positive thing. And there's only so much that we can do within the work setting too. So I tend to encourage folks that are on my team, folks that are in Paychecks, that especially our younger employers, but not just limited to them, that there's an awful lot, it gets back to growth. When we're growing, things are better. There's a lot of skills and experiences that we can get outside of work. And we can bring some of the things that we know, some of our skill set to the community and be better there. The community will be better off. We'll be better off as individuals, and our organization will be better off.
I had a thought and I lost it. Yeah, right. So actually, I think you could start small. I think you could start really small. I work in a very small organization. You could start with one little thing, and this sounds silly, but building community can be as easy as having a potluck on Friday afternoons. It doesn't have to be this grand gesture. Sit down together. Yeah, a healthy potluck. Yes. Go for a walk together. Come up with some opportunities to socialize, where it's not all about the bottom line and the end result, but it's about learning who each other are as people and appreciating your similarities as well as your differences, because when you're working in a team, you're gonna have differences, and you gotta figure out that that's a person next to me, and even though I don't agree with them, we need to work together, and the only way to do that is to create a relationship. You don't have to like the person, you don't have to, be best friends, but if you can create an opportunity, small opportunity in small organizations to become relatable to one another, I think that that's a really good step in moving forward, and then that sense of community will grow. But it does have to start small, I think.
Eric, is that something that your clients or companies are looking for?
Yeah, absolutely. I think we've seen a lot of organizations that we work with have developed wellness committees or wellness teams that want to focus on what can we do as fun events. There's also a strong push for more work-life balance, especially with some of the more progressive organizations. What's interesting is how they define work-life balance. So there are some organizations that talk about work-life balance as let's have a potluck, let's take a walk together. There are others that define it as we want to make sure that you have time on your own to spend doing whatever you want. So we're going to give you flexibility. We're going to have compressed work schedules, or let you do a 4-day work week or something like that. What's interesting is that while those definitely give people more time to engage in interests and activities outside of the workplace, they inherently mean that people spend less time together at work. If you're coming and going on a less regular schedule, if people all take lunch at a different time, they can't go for a walk together at lunch. If people all leave work at different time, they can't grab a happy hour afterwards. So it's interesting to see the conflict of the duality in definitions of work-life balance and how those are inherently at odds.
So I'd like to go to the audience. If someone has questions, I'll bring the mic to them and they can introduce themselves and ask a question. You don't want me to keep going. I got lots of stories. Yeah, thank you.
Thank you guys so much for this enriching morning. My name is Celia. I'm with the College at Brockport. And one of the presenters, you talked about community preparedness. And how do you know, so the question is, how do you know if a community is prepared? And if you find out because you launch an intervention that they're not ready, how do you prime the community to become ready?
I think that the best way to understand community readiness is to really understand what are the issues that are of interest to the community. I think the mistake that we tend to make in leadership is thinking we point the direction and people follow, instead of understanding the people are pointing the direction. And I would say that what stands out to me in Brockport are, first of all, the incredible sense within the Brockport community of how overlooked Brockport is in the context of county conversations. And that's palpable when you talk to folks at the street level in Brockport. So there's a real readiness for Brockport's issues to be elevated and surfaced. Number two, very much common to most of the rural parts of the community, Brockport is very much aware of the impact of the opioid crisis and how that has brought new forms of violent crime into the community that we used to associate with the heart of Rochester or Elmira. And Brockport understands, as does Wayne County, the most heinous crimes we've seen lately have really been in rural communities. And so I think community readiness is best found when those of us who seek to engage the community have open ears and an open heart to really understand what the community is saying. And I think that was the brilliance of our partnership with the business community around high blood pressure. That it really was something that the business community was able to engage in, find the level of community readiness, and quite honestly, to this day, if you go to our health coalitions, the churches, the barbershop, they won't say this was the business community's idea. They'll say it was their idea, and they brought the business community along. That's the essence of leadership. That when all is said and done, the people say, we did this ourselves. And I think that's the best way to really find and leverage community readiness.
Yeah, I'll add a mechanical suggestion to that for you, Celia. So what some communities are starting to do is they're partnering with their emergency response folks. Not to do, like airports have to do crises, like, oh, there's an air wreck at the airport, what do you do, like an exercise. But there are ways that, you know, some county health departments and nonprofit hospitals, things like that, are working on, like, it's a little more of the things that are a little more stark, like opioid uses. What are we going, let's do an exercise where we figure out what are we going to do when opioid rates double, right? And sort of, and going and having everyone sit down, do like, it's like a tornado hits or floods or something like that. Partner with them and figure out how do you like prep for that. And there are some communities are starting to do that. Just, you know, get everyone in the same room and figure that out.
Yeah, I think, you know, one of the great, just to add on a little bit to what Wade said, Lawrence, what you said, one of the great things about Rochester is it's big enough to do things, but small enough to get things done.
Amen.
Right? And so if you've got an interest in doing something, I would say just tell one or two people. They're gonna know. It may not be the person that needs to know, but they'll know the person, or they'll know a person who will know the person. All you have to do is speak up to find out what's going on. In fact, I think that's oftentimes our greatest challenge is there's a lot of good work happening. It's, you know, the challenge is in getting everybody aligned so that we're on the same rope and that we're pulling at the same time to get maximum impact.
My name is Kathleen Brightnoth. I'm a psychologist, and I have been in the business of cleaning up the mess of this sort of thing for like over 30 years. And I have become interested in like preventing having the problem instead of cleaning up the mess. So a lot of people, I think, don't know what to do to help themselves. They don't know. People think they know how to eat, but they really don't. And they don't know about how to meditate or use breathing practices, or all, and reduce their exposure to toxins. And I think that is huge. And because a lot of people think, I'm going to go to the doctor and the doctor's going to fix me. Well, they're not going to. They're going to treat the symptoms, but they're not going to get rid of the cause. And so that's what I am on a mission to kind of figure out, is how I can be a part of that. And I wondered what you thought of that, is prevention. And you know, you can give a drug to treat high blood pressure, but it'd be better to get rid of high blood pressure. And you can, and diabetes, type 2 diabetes is a lifestyle illness. It's not necessary. And the mental health and the physical health is really the same thing. It's the same thing. And I just wondered what you thought about that.
So maybe I'll take a real quick stab at it and just say, I think when we think about prevention and a focus on health and healthy lifestyles, that I can tell you, and I've said this, Wade's heard me because he's known me for a number of years, at Paychecks say, I'm tired of blaming people. And we're awful critical about, you just need to lose weight, right? You need to eat better, you need to get more exercise, you need to be able to deal with that stress a little better, and we need to be better. We're talking a lot about it at Paychecks, about having that same critical lens about our organizational practices. So I think each of us that are representing employers need to think about that first. Do our policies and practices support well-being, yes or no? And not just make it the individual's problem and continuing to try to get them to change when so many things are stacked against them. And I think that's true for the community as well. You know, we need to take a look and say, does our environment today support well-being, yes or no? And the great news here is the stuff that we're talking about is man-made and literally mostly by men. Right? It can be fixed, it can be undone. We just have to have the willpower and willingness to interject change. And I would say one place that I would love to see us start in Rochester is be a leader in integrating physical and mental health. We know it, everybody understands it, we just have to be willing to do something different.
Amen.
I think 100%, yeah, doing something different is really the answer. You can't continue to look at the same situation or concern with the same lens. If you want to change how things are, you have to change what you're bringing to the table. So one of the things that we do at WPV is work with organizations and individuals to develop and refine their wellness programs. And what we often see is we'll go in and do biometric screenings and give beautiful reports on, hey, 60% of your population is overweight or obese. It stops there oftentimes. We can help you to, let's move that dial. And the dial is really hard to move. It is really hard to move. It's not easy. We can help you. So what are you going to do with that information? It's not just about gathering the information. It's about trying to do something with it. And I think you're right that looking at things with a different critical lens of, are we walking the walk? Are we doing the things as an organization that are fostering positive health habits? And positive mental health habits are so impactful on everyone's well-being. It's so important. So I think we definitely all have to look at that for sure.
And to me, two of the biggest pieces of that are education and peer support or peer pressure. Nobody wants to have high blood pressure. Nobody wants to have diabetes. But a lot of people don't know what they're doing that's leading to that, what they're doing that can prevent that, and making sure that they're educated in a forum that can reach them, whether that's at home, whether that's a community-based education, or whether it is a workplace education. And if it is a workplace education, is it a mail stuffer? Is it electronic? Is it a lunch and learn? How are we reaching people in a forum where they're ready to listen and to learn? And then how are we supporting them? How are we peer pressuring them? How are we making it so that it's okay to grab an apple instead of a Snickers bar? Betsy's organization actually did flu shots in our office, and a bunch of people were getting flu shots, and I thought I was too busy. And I was walking past the room where they were doing flu shots, and one of my coworkers said, "You gotta get a flu shot." Okay, I'll jump in. And it's 3 minutes out of my life, but that peer pressure and that peer support is really meaningful in making sure that we follow through on those outcomes.
And I would just add in that as a diagnosed hypertensive patient and as a person who's living with adult onset type 1 diabetes, we don't choose what life brings our way, and unhealthy habits really reflect the diversity of what life is in America. I reached my level of professional success by not eating lunch, by power charging through the day, and that to me was always a rational choice. Eric's point of the beauty of peer pressure, peer support, I work with 42 people who now force me to stop every day and eat lunch, and it's really a very difficult habit for me to master because that feels to me as not being productive. And that makes me think of the person who's working the cashier stand at Target. When they take lunch, they're losing income. We really need, I think Jake's right, we need to think about what is the structure of how we live life as Americans, because this is an American phenomenon. We believe that microwaving is cooking. And we have to think about how do we disengineer those things. And I just wanted to take the mic, and I'll stop being the CEO of Common Ground Health and be Regent Norwood, and again plug and beg you all. I don't understand why we give a high school diploma to someone who's not skilled in health self-management. Why do we think health should be 3 half semesters in a K-12 trajectory? I mean, that's just ridiculous. I mean, we should really be saying high school and middle school and elementary school curriculum should teach mindfulness, should teach meditation, that yoga and reflection should be a part of what a student's life is like. I mean, we've done, Pogo was right. We've met the enemy. He is us. But we have real opportunities, and I'm telling you, by the end of 2021, high school diploma requirements are going to be redesigned for New York State. And that means all 700 districts in New York State are going to have to redetermine what does it mean to earn a diploma in light of the new state standards. This is an opportunity for you all to have voice. These are things you ought to be talking about with teachers, with principals, with school board members. You should be using your voice to say, let's stop the madness. And let's get upstream and start dealing with the challenges we have while young people are still learning what are the mores of living.
Can I do one thing? Just, my wife's a teacher, a special ed teacher, for over 20 years. Your point on yoga, it's sort of interesting, right? Self-contained, 7, 8, and 9th graders. And she's got the kids doing yoga and yoga meditation, but guess who the biggest resistors are? It's the adults.
Amen.
It's the adults.
Amen.
The kids love it. The kids love it. These are kids with severe developmental disabilities, and it's a highlight. The other thing she gets resistance on is she insists whenever possible the kids are going to go outside for even 5 or 10 minutes.
Exactly.
Guess who resists that the most? It's the adults.
Amen. No such thing as bad weather, only bad clothing.
I'm going to tell her that.
Yeah, oh, we got a couple back here. Let's go ahead and do both questions and I'll have them addressed because we're close to time, so let's do all the questions and all at once.
Good morning, my name is Kelly Mizell. I'm from Living Well Companion Care, so I'm kind of taking a different angle, looking from senior living. As people tend to age longer and we work longer, we're going to start that sandwich generation where we're going to be taking care of aging parents, working full-time, and trying to balance a family as well. Do you think organizations are going to start looking at how to support caregivers in the community?
So caregivers will table that for 1 second, and then.
My name's Greer Gladney, I'm from Jordan Health, and in talking about wellness and getting out into the community, there are a lot of communities where just because of the structural issues, the neighbor blocks do not get plowed, the streets don't get plowed, so getting outside of your house just to get some exercise is not that easy. 2 streets away on Barton Street, half the winter, it's not plowed at all and you can't get out on the sidewalk. So how do you address being able to, particularly for youth, lower rates of obesity, get more wellness, get more integration when your environment doesn't provide for it?
Okay, so question about caregivers, then a question about improving the environment to make it easier to live well.
So I'll just jump in, and then I was going to give to Betsy on the caregiver one as a clinician on the panel. Yeah. I think that's a great point. I mean, and I would just say it's unacceptable. It's unacceptable not to have streets plowed and sidewalks cleared. Like, why is that? You know, we just need to take a stand and say we're not willing. All of us, not just the folks that live on the street or live on a contiguous street, but all of us recognize that if being able to get out and move physically is good for us, let alone allows us to get to a job, if we have a job on time, or get our kids to school, or whatever it might be, it's just unacceptable.
I'll agree with that. Coming from, I actually am from a rural community around here, and so lots of times there's, you can't get out, and you have to get yourself out. So you know, and that's unfortunate, and I think that is a barrier, particularly in a rural community, in getting folks, you know, not only out, but into the community and socializing and all of those things. In terms of caregiver support, it's an amazing conversation, and I think it's something organizations need to start looking at, and I'm not sure that it's probably on the forefront. But gosh, when you meet with somebody who is stuck there, I shouldn't say that, who is in that place, who's trying to take care of, you know, a loved one, and also do their job and work, it is extremely, extremely stressful. And I think that will weigh into, I know that will weigh into their physical health and their absenteeism. And just like having children, it's, you know, it's something we have to do as we age, and we're working older now than we ever have been in the past. I think it's something that organizations definitely need to start to take a look at. You know, it's a great thought, actually. Yeah.
Just one quick thing, sorry. And, so if we think about from a business perspective, caregivers in the provider community as suppliers of medical care for us as purchasers, and our employees and their dependents as purchasers, we need to be just talking, you know, better and more frequently together, right? Because if we reduce this, and Bob Davis is here, and I got this from Bob years and years ago, when he really kind of got me thinking, and the sad thing is I don't think we've made great progress, is think about things from a purchaser-supplier's, you know, equation. If I'm buying something, right, and my supplier is struggling and they can't provide me with what I need on time and in good quality, I've got a problem, I've got a business problem. And I think if we would just think in those terms, we would do things differently. And we would recognize, what are your needs as a caregiver? How do I support caregivers? Because if I don't, then who are my folks going to when they need care? So I just think from a pure business economic standpoint, we have to have that lens. It's an important lens. And historically, I think employers have had intermediaries in between themselves and their suppliers, and that's got to end.
One other thing on the caregiver piece, the caregivers that you can hire or that who can be supplied through you for a limited time under, you know, Medicare or Medicaid longer term, those folks are paid $10 an hour. And they have to have a working vehicle to get where they're going. And that they can't be on a bus line. They can't be, you know, walking to people's houses. And they can go and flip burgers for $14 an hour. What's your choice? And that's the person that's gonna take care of mom and dad at home while you go to work.
Or me in another 10 years.
Okay, well, thank you everyone. To keep us on time, so Dr. Crawford is already at the podium. I'd like to thank the panel for attending here. Just